Hello. My name is Autumn and I am doing child-centered play therapy. Oh, sorry. Okay. Description and overview. So, when I looked more into child-centered play therapy, it I found that there were three basic concepts that it wrapped itself around, which were empathy, unconditional positive regard, and congruence. And of course, it developed from play centered therapy, which is more used with, of course, used with adults rather than child centered. But it became more of a place for children to explore themselves and how they're feeling and how events that have played out in their life based around, the trauma that they've experienced, um, and kind of play those out in sort of some of the scenarios, um, where you might be playing and see the child playing either in a group or alone, and how they decide to play with the toys can sometimes help you interpret what happened. And then there's different like environments that can be set up. Of course, it is still a counseling setting, so trying to make it the most comfortable that it can be for the child, and make sure that they are okay with their environment and they feel safe playing with their environment, and the toys can be set up like specific toys that they want, or ones that they don't want, because they might be scared of a certain object or a certain toy, so you might not want to include that in your environment. But different environments can be set up to make kids more comfortable, just based on everything. So, application with children and adolescents. Of course, it is important to get a child to engage with you and be willing to engage with you. So having something like rapport and building that trust to allow you to engage with the child, or allow the counselor to engage with the child, and have the child be comfortable being in a safe place with the counselor to talk about their emotions, or let the counselor sort of guide some of these conversations based around their play and what they're interpreting from it, and maybe sort of just asking them, you set this up this way, or you're playing with it this way, does that how does that make you feel? Like, I notice you're doing this, you might be feeling this, and just sort of throwing something in there to see how it's going. But trust also allows the client to feel safe and comfortable in that spot while they're being counseled. um and then letting the child play during the time allows the environment to feel more calm and comforting to them. Directly speaking with children can sometimes be a bit harder, especially in counseling. I know with adolescents too, just because of some of my past work, it is a bit hard to get an adolescent to open up sometimes about, how they're feeling, and, what might be going on. So, being able to allow them to play with things in their environment that they might enjoy, stuffed animals, or, you know, loom beads, or stuff that they like, just to help them settle in more to the environment. So the rationale behind the use of child-centered play therapy, it I guess the main statement that's going to be like the underlying main point of this is just allowing an open space for children to be able to express their emotions, and gaining rapport with a counselor, and being able to share more openly with a counselor than they would in a direct, conversation environment, when you're just sitting in a chair and talking like you would with adults. Um, it also allows a better connection between the parent and child, because you know what the parent doesn't know, but the counselor might find out, just depending on what the counselor can and can't share, and just based around what the parents have talked about or what they're worried about. Maybe being able to ease some of that, or not directly go against ethics and all that, but just being able to kind of ease the parent's mind, and know the child is in good hands, and they're being helped. It also allows the counselor to be a medium. If the child were in, any sort of danger and, all mandated reporting, we're all mandated reporters, but just allowing, a counselor to figure out more of what's going on, maybe based on even interpretive concepts, and I'll talk more about that in the intervention part. Um, and, I found more about symbolism from the Bratton article, but symbolism in the way that the child is playing with their environment and communicating, their feelings through, maybe dolls, or, communicating things through just, like, I know sand therapy is a thing too, but like maybe they make a Play-Doh figure, and that can be interpreted to, be their dad, or someone who did something to them, like if they're being bullied, and it just building on top of that. Okay, the efficacy for this. So honestly, based on what our text said, being able to let the child sort of draw their own conclusions about how they're feeling, and how they want to express how they're feeling, and how they decide to go about, expressing themselves and making themselves feel comfortable, as well as, letting the counselor sort of be a part of their play and be a part of their environment. Of course, as I stated before, making sure that anything that the child might be scared of, like clowns, I think was the example in the textbook, but like maybe they're uncomfortable with dogs, maybe they're uncomfortable with, male figures, maybe they're uncomfortable with, I don't know, a certain color, but making sure that there's less of that in the room, so that the child can be productive and meet, their needs, and, help them feel like the place that they are in is safe, and they are able to express how they're feeling, and help with their emotions, and being able to see their developmental needs, and taking that away through their play. So children versus adults. It I couldn't find much based around it, because it is child-centered play therapy rather than just play-centered therapy. So it was a bit harder to, find more about that, just because this therapy intervention is mostly used with children, and play center therapy would be used with adults. Nonetheless, the textbook did mention that it allows, it does allow adults to relive events in their lives, as it does for, children to be able to relive events in their childhood, and, relive events that might have just occurred, and, they might need help for. And there was a lot around another article I found about developmental disabled adults, and being able to be more social, especially if in a group setting used with play-centered therapy, and being able to, be in those social settings that they might not always be used to, as well as, receiving that counseling that they might need if they need to express their emotions, and giving them that safe space to do so. So presenting concerns and use. So it can be used for a lot of things. One of the main things that I found was like social aspects, and like socially lacking. So of course, there's a lot on the list, but I think the bottom point covers a lot with, honestly, any sort of problem the child is having, or any trauma that the child might have had in the past, where they might need to, express it, but they express it through play. And so they might need some help, getting through that, and, being able to have a counselor there to help them, understand how they're feeling, and maybe just understand more of their emotions, and have the counselor help guide them like we would in, regular counseling as well, but in a more comfortable spot for the children. It helps with a lot of different issues, some even regarding like families. like a foster care child coming in and, having a tougher time adjusting to the system, or having a hard time adjusting to their foster family, or even just, a hold setting. Um, Even, if a child has been adopted, maybe having trouble with that adoption and, transitioning into their new home, or, their trauma that they might have brought with them into that home or the system. And, other things such as abuse and neglect, anxiety and depression, attachment behavioral, bullying, fears, grief, and, on and on. There's a ton of things that child centered play therapy can be used for. So, interventions. A big one I found was group interventions, just because it allows the children to be more social and, interact with others around their age who might have the same temperament, and, all the other factors that have to be involved when deciding if a group intervention is the way to go or whether individual intervention would be the way to go. It allows, the child to have space. So, allowing the child to have an open play area where they can play and not be interrupted, but also allowing them to, open up and, interpret. As I put at the bottom, like interpreting play and interpreting maybe those drawings and paintings that the kid does, and scanning everything regarding their play as well into, emotional content, and seeing how that might be related to how they're feeling now or what might have happened, and how that might be dragging into their feelings in the present moment. And then, the verbal and the nonverbal components, like reflecting and tracking behavior, narrating. And I think narrating is helpful just because I have worked with kids and I narrate play as well, um, with my ABA therapy that I do with my kids with autism. Um, but narrating their play sort of helps them to, understand that you're still there and you're still, there to help them understand those emotions that you might be spotting, but they might not be spotting. Um, and just, be able to push the conversation further and sort of, make it a more comfortable conversation for kids. And these are my references. And thank you very much. That's the end of my presentation.